And a bit closer to the action is our guest, Professor Ramneek Ahluwalia, CEO of Higher Health, who is currently in Singapore, and he joins me now. Professor, good afternoon. Appreciate your time today. Now, you might have heard in that outro a minute ago that the South African Department of Health has said there is no need to worry at the moment, no need to impose restrictions on travellers coming out of mainland China.
No, I fully agree, Hugo. Thank you, and Happy New Year to everyone. 1 billion people have been infected with this Omicron variant, which is in circulation at this moment in China or in other parts of the world. We must also remember that global north is experiencing harsh winters. What does winters bring is indoors, less ventilated zones, and that's what the viruses enjoy usually. And China has a different story because it has aging population. Very few people, not the majority, got vaccinated. Old people are in huge numbers. So I think with winters in China, it is a challenge with the spreading COVID virus. But we have to remember that the virus in circulation currently is still the subvariants of Omicron. So 1 billion people over a year. We've seen early January 2022 when we saw Omicron as a new variant coming in, and this variant has been in circulation. So I think there's no need for panic in South Africa. South Africa has got enough immunity developed with population being vaccinated, but mostly population acquired immunity because our lockdowns were not as severe as China had imposed, and this led to a lot of population getting acquired immunity, which means 80% of South Africans got the infection of COVID. And while the other side, we boosted our immune system via vaccination program. So I think the current subvariant is still Omicron. A number of subvariants seen from US data or UK data is still from the Omicron family, which is a very good sign for the world to see that the variants have not changed. The subvariants, yes, they are always to be concerned because what the subvariants are trying to do in Omicron, they're becoming more infective, and they're also trying to escape immune system. But the immune system, they're not going to be able to escape to the level a new variant can try to. So I think that brings a lot of hope, and I think there's no need to panic. And I think I fully agree with the previous speaker around how the government is taking at this moment.
So, in your response, you've suggested that China certainly got it wrong in as far as maintaining the restrictions that they had on their population and only opening it up, removing those restrictions now. And that potentially is what has caused this sudden upsurge in coronavirus in China.
I think it's a wrong interpretation. Every government has its own policy and systems in particular. But yes, from the outlook of where we sit, we really see that those lockdowns were not effective, considering that the population did not achieve what we call it as acquired immunity, like an example of South Africa, where the population in majority, because of our relaxed lockdowns, unfortunately people were exposed to the virus, and that led to our own immune system building while we put a vaccination program in place. So the only way to escape a virus which is as novel as coronavirus was either to boost our immune system by vaccination so that our body recognizes a virus like coronavirus and produce enough immunity to fight it, or getting an acquired immunity, which means being infected to COVID-19. Well, older age or people with comorbidities, as we've always been speaking about, remains an absolute danger to COVID-19. And that's why acquired immunity was quite worrying even immediately around that phase, because those people's immune systems were not going to be able to counter a novel coronavirus. But with the vaccine immunity, with an acquired immune system, these things do happen. And I think that's what China is trying to now learn from the world, opening up its lockdown systems, letting the population coming out of COVID-19. There will be acquired immune systems where many people who are not vaccinated or who do not have a previous infection will have a severe COVID-19, and people who are old or comorbid will have to be admitted, and that's exactly what's happening in China at this moment.
Well, at the time that the coronavirus arrived, if you will, it had been 100 years since a pandemic of a similar nature had been experienced. So there basically was nobody with any experience to speak of. So it really has been a massive learning process, including the fact that we were on most of Europe's red zone when we got the Omicron variant here in South Africa. Now, talk to us about some of those key lessons that we've picked up in the last 24 months, if you will, Professor.
I think it's a brutal reminder that human mankind is in danger with the evolving the viruses, our environment, our climate change. It's a reality that in the current world, with our population has grown to that level, that it's breeding grounds for many viruses that remain dormant, or new viruses that are being formulated, which we call them as novel, because our humans are not exposed to them. They might be coming from animals. They might be existent in many different forms of reptiles or mammals or other formulations who can develop a human-to-human transmission. And I think COVID is one clear example. World saw in smallpox about decades and decades back. It took so many lives and took so many centuries for us to overcome. Exactly got reminded with COVID-19. And the quick succession of how smallpox was eliminated in 1970 and a quick rise of COVID-19 in just about 40 years clearly shows that how evolution of these viruses will happen. And I think weather climate change is a huge thing. So I think the world is opened its eyes into this reality. Science is a response. I mean, we've clearly seen when the scientists came out talking about vaccination, the whole world united itself in finding a vaccine into it, and vaccines have shown to be proven. Clearly starts showing how science will lead the future of the world and how evidence-based science needs to be what government's policies needs to be around. There has to be a place for scientific world and scientists. There has to be funding. There has to be investments into every nation, including Africa. A big lesson for Africa is not to be dependent on global north. We have to be self-reliant. There are many diseases that happen in Africa which have nothing to do with the global north. And global north does not investments in trying to realize them. Malaria is a great example. Ebola is an evolving virus, and it's going to be a time when it's going to mutate to a level that is going to affect a similar kind that it affects isolated parts of our African continent. So I think it's a wake-up call. We have learned our lessons. We have to now not let our guard down. What we have put investments to COVID vaccines, COVID preventions, the type of science we have brought together, the genomic sequencings that we have put together, we need to continue with. And governments need to ensure that budgets are put together, science being promoted. And I think that's going to be our 24 months of learning. And I think the virus is not yet over. We've not yet come to a stage where we can say it's out of a pandemic stage or it's become an endemic at this moment. No, not at all. We're still watching COVID very clearly. The good signs are that 1 billion people were infected to one subvariant, one variant called Omicron, and it has not led to a further mutation to a level that a new variant has been developed. But subvariants are being developed continuously. So I mean, we're not out of COVID. We're watching it. But there's a lot of learning lessons so far for us.
Now, something that we've recently learned is that there's a new variant called the XBB.1.5 that is causing panic in the UK and in the United States. And I'd like to think that this could potentially be a banana skin for the West versus China. Because does China then say, okay, you can't come onto our shores, or if you do, you must show us confirmation that you've received the jab and that you are negative of coronavirus. But what do we know about this new variant? Because I understand that it is impacting 1 in 25 of the cases of coronavirus in the UK.
Hugo, I just want to correct you. It's XBB.1.5 is a subvariant, not a variant. A subvariant is still a subvariant of the variant called Omicron, which is so it's a mutated form of an Omicron, which has further led. Yes, definitely. United States, United Kingdom is in winters at this moment, like China is. Indoors again, less ventilation, population quite exposed. Festive season, Christmas has just been out. So COVID has got a free flow in that, and it has led to some mutations that have clearly happened onto the existing spread of the variant that was moving, like the B5s or the B1s, the B3, which has led to a development of highly more infectious and some kind of escape mutations, which means XBB is showing that the previous immune system produced by the vaccines or acquired immunity can be escaped, which means a lot of people will get reinfection. Even in South Africa, we have to embrace the reality that XBB.1.5 will reach South Africa too, and we will have reinfections. Reinfections are common in virus evolutions as long as from a subvariant, and our immune system will eventually be able to overcome it, which means like a seasonal flu virus happens, we will have the flu but a milder version, and it will move away. Very little hospitalization needed, very little oxygen therapies needed. And exactly that's what we're seeing in the United States, in the United Kingdom, and I think China, many variants. It's not, as I'm saying, it's not just the XBB.1.5. There are so many subvariants that are circulating in China, and as we're seeing the data, but as we say again, these are subvariants of the same Omicron. There is no need for any restrictions, whether it's United States people coming to China or Chinese people going to the United States. I think it's not going to work. At the end, the virus is going to still find ways to leave the shores. The virus is still mutating in those countries. The virus is mutating everywhere. The question is, have our immune system as humans not let the virus now to mutate to a level that it develops into a totally new variant and surprises us like the novel coronavirus did. The first formulations or the new variants that came after that, like the alpha, the beta. Yeah. But the subvariants will continuously happen. Even humans are mutating regularly, as our mutations are very slow compared to viruses. Viruses mutate quite faster. So this is a normal evolution. US and UK will have reinfections of lots of people. The hope is it's still Omicron, and we are not seeing a new variant, so the cases should be milder and should lead to less hospitalization and no panic at this moment.
Well, that's good news for all of us. Professor, appreciate your time this afternoon. We were speaking to Professor Ramneek Ahluwalia, CEO of Higher Health, and he was just unpacking the issue around coronavirus, particularly in China, where it seems to be reinfecting multiple millions.